Before I say anything else, I want you to try something right now. If you are in a safe place, near a wall or a counter, stand up and lift one foot off the floor, just a few inches, and hold it, count to 10. If you grabbed for support before reaching 10, or if your foot came back down before you got there, your body has just given you one of the most important pieces of health information you will receive today. Not because a 10-second balance test is the point, but because what that wobble represents goes far deeper than most people realize. As a physician, when I see a patient unable to hold a single leg stance for 10 seconds, I do not see a normal aging process. I see a warning signal from the nervous system, a signal that the communication pathways between the brain and the body's balance mechanisms are degrading faster than they should be, and I see a fall waiting to happen. Falls are not random events. They are predictable. The research on this is unambiguous. The inability to balance on one leg for 10 seconds is among the strongest predictors of falls, hip fractures, and loss of independent living in adults over 60. These are not minor inconveniences. A serious fall in an older adult is frequently a turning point, the event that marks the beginning of a decline that many people never fully reverse. But here is what I want you to hold on to from the very beginning of this video. This is reversible. The brain retains its ability to form new neural connections well into the 70s and 80s. The balance system can be retrained, the muscles can be rebuilt, the pathways can be restored. Today I'm going to give you 4 specific exercises, the exact 4 that I have used personally for 3 years, and the 4 I prescribe most consistently to my patients. Together they address every component of the fall prevention equation, and together they take less than 15 minutes. Let us begin with the science, because understanding why you are doing something is what turns a temporary habit into a permanent practice. 3 things happen simultaneously after the age of 60 that create what researchers call the perfect storm for a fall. The first is sarcopenia, the progressive, age-related loss of skeletal muscle mass and strength. Without targeted resistance training, the body loses between 3 and 8% of its muscle mass per decade after 50. By 80, an untreated individual may have lost 60% of their peak leg strength. This is not an abstract statistic. It is the direct reason why getting up from a chair requires effort, why stairs demand concentration, and why catching yourself after a stumble becomes increasingly difficult. The second is vestibular deterioration. Your inner ear contains a sophisticated system of fluid-filled canals and sensory hair cells that detect head movement and orientation in space. This system degrades naturally with age. The hair cells become less sensitive. The signals they send to the brain become less precise. The result is a reduction in the speed and accuracy of balance corrections when something unexpected shifts your center of gravity. The third is proprioceptive decline. Embedded throughout your muscles, tendons, and joint capsules, with the highest concentration in your feet and ankles, are millions of specialized nerve receptors that continuously report your body's position to the brain. With age, inactivity, and years of walking in cushioned shoes on smooth surfaces, these receptors become less responsive. The signals slow down, and slower signals mean slower reactions. When all 3 of these systems degrade simultaneously, and they do in virtually every adult who does not specifically train to prevent it, the result is the cascade of instability that ends in falls. The encouraging reality is this: the brain's neuroplasticity, its ability to form new connections and strengthen existing ones, remains meaningfully active well into the 80s. The right training stimulus applied consistently reverses these deficits, not partially, substantially. These 4 exercises provide that stimulus. The first exercise is the most important one on this list, and it is the one I have performed without exception every single day for 3 years. Stand next to a wall or sturdy counter. Place one hand very close to the surface, not resting on it, but close enough to catch yourself instantly if needed. Shift your weight completely onto your right leg. Lift your left foot just a few inches from the floor. Now, the detail that most people miss, and that makes all the difference. Keep a very slight, deliberate bend in your standing knee. Do not lock it straight. A locked knee transfers the stability demand from your muscles to your ligaments, passive structures that do not adapt or improve with training. A softly bent knee forces the muscles of your foot, ankle, and hip to fire continuously, making the hundreds of micro adjustments per second that balance actually requires. Fix your gaze on a single still point on the wall in front of you. This visual anchor helps compensate for vestibular deficits while you build the proprioceptive strength that will eventually allow you to balance even with your eyes closed. Hold for 10 to 30 seconds. Then switch sides. Here is something important. You will almost certainly find that one side is significantly more stable than the other. This asymmetry is not unusual. It is actually clinically valuable information. It tells you exactly where your balance system has the greatest weakness, and therefore where your training attention is most needed. Repeat 3 times on each side. Breathe continuously throughout. Holding your breath during a balance hold increases pressure within the chest and can cause dizziness. Your progression over the following weeks. Begin with light fingertip contact on the surface. After 2 weeks, hover the hand without touching. Then cross your arms over your chest. Then, only with a wall directly behind you or someone present, try briefly closing your eyes. 3 minutes a day. This is the exercise that keeps you on your feet. The second exercise addresses something that the first does not: dynamic balance. The ability to maintain control while the body is moving. Because here is the reality: most falls do not happen while you are standing still. They happen during transition, stepping off a curb, turning a corner, navigating a doorway, changing direction quickly. As people age and their balance confidence decreases, they unconsciously adopt a wider-based, shuffling walking pattern. Feet further apart, shorter steps, slower pace. This feels safer, but it actually reduces the body's ability to react to sudden perturbations because the wide stance removes the very balance challenge that keeps the system trained. The heel-to-toe walk addresses this directly. Find a clear hallway or a clear stretch of floor. Place one hand lightly on the wall beside you if needed. Now walk forward, placing each foot so that the heel of your front foot makes direct contact with the toes of your back foot, one foot directly in front of the other, like walking a tightrope. Keep your chest upright. Your gaze should be forward and level, looking at the horizon, not down at your feet. This is critical. Looking down at your feet shifts your balance strategy toward visual dependence, which is exactly what we are trying to reduce. Looking forward forces your proprioceptive and vestibular systems to do the work. Take 10 to 20 steps, turn carefully with a wall or support nearby. Walk back. The narrow base of this walk forces your cerebellum, the brain's motor control center, to work intensively to prevent lateral sway. Every step creates a momentary instability that your core and hip muscles must respond to rapidly. This is precisely the neural training that translates to better stability when real-world unpredictability catches you off guard. When 10 steps feel manageable and comfortable, the progression is to perform the walk with your eyes closed for a few steps at a time, but only with a spotter present or a wall within immediate reach. The third exercise addresses the structural foundation that balance and coordination depend upon, the muscles of the lower body. Neurological coordination without muscular strength is incomplete. Your brain can send perfect signals, but if the muscles receiving those signals are too weak to respond adequately, the fall still happens. Rebuilding lower body strength is non-negotiable for fall prevention. The half squat is the most functional version of this rebuilding for adults over 60 because it targets precisely the range of motion used in daily life, not the deep athletic squat of a 25-year-old. The 6 to 8 inch descent that gets you out of a chair, in and out of a car, up from a low seat. Stand facing a wall or counter. Hands available for support but not bearing weight. Feet shoulder width apart. Toes turned very slightly outward. Now initiate the movement from your hips. Push them backward, as if reaching for a chair that is just slightly too far behind you. Allow your knees to bend as a consequence of your hips moving back, not the other way around. Descend only 6 to 8 inches. Your weight must remain in your heels throughout. If your heels begin to lift, you have gone too far forward. Keep your chest lifted and your gaze forward. Now, the tempo is everything. Take 3 full seconds to lower. Pause at the bottom for 1 second. Take 3 full seconds to rise. This slow, controlled tempo, what exercise scientists call time under tension, stimulates muscle protein synthesis and strength development without requiring any additional load. Your own body weight, moved slowly and with control, is the resistance. Perform 3 sets of 5 to 8 repetitions. Rest fully between sets. Your knees must track in the same direction as your toes throughout. Never allow them to drift inward. If you notice inward drift, reduce the depth until you have built the hip strength to maintain correct alignment. The fourth exercise targets a muscle group that is almost universally overlooked in conventional fitness programs and whose weakness is directly responsible for one of the most common mechanisms of falling in older adults: the hip flexors. Specifically the iliopsoas, the deep muscle group that lifts your thigh upward during each step you take. Here is what happens when this muscle group weakens. The foot no longer clears the ground completely during the swing phase of walking. The toes drag slightly, not dramatically, just slightly, just enough to catch on a rug edge, a door threshold, a small raised crack in the pavement. This is the mechanism behind what clinicians call the senile shuffle, the shortened, dragging stride pattern that develops gradually in older adults and dramatically increases trip and fall risk. It is not a neurological disease. It is a weakness in a specific, trainable muscle group that most people never specifically train. The seated leg raise isolates this muscle directly. Sit upright on a firm, sturdy chair. Your back should not be touching the backrest. Sit away from it, using your own spinal muscles for support. Feet flat on the floor, hip width apart. Gently engage your abdominal muscles to stabilize your lower back. Now lift one leg, raising your thigh until it lifts completely off the chair seat. Your lower leg hangs naturally. At the top of the movement, hold for 2 to 3 seconds. Feel the contraction at the front of your hip. That is your iliopsoas working. Then lower the leg slowly and with complete control. Do not allow it to drop. The lowering phase builds the eccentric strength that is just as important as the lifting phase. For an additional benefit, as you lift, pull your toes toward your shin. Dorsiflex the foot. This engages the tibialis anterior, the muscle running along the front of your shin that lifts your toes during walking. Training this simultaneously with the hip flexor addresses both components of the foot clearance mechanism in a single movement. Perform 8 to 12 repetitions on each side. Here is how to structure these 4 exercises into your week. Perform all 4 every single day. This is not an arbitrary recommendation. Balance is a neurological skill, and neurological skills require daily practice to develop and maintain. Unlike strength training, which requires recovery days, balance training can and should be done daily. The entire sequence takes 12 to 15 minutes. Single leg balance, 3 holds of 30 seconds each side. Heel to toe walk, 2 lengths of your hallway, half squat, 3 sets of 5 to 8 repetitions. Seated leg raise, 8 to 12 repetitions each side. For the first 2 weeks, keep all movements at their most supported, most controlled versions. Use the wall, use the counter, use the chair. There is no value in progressing before your body is ready. After 2 weeks, begin introducing the progressions I described for each exercise, gradually, one at a time. Consistency is the only variable that matters. 2 weeks of daily practice produces measurable neurological adaptation. 4 weeks produces changes you will feel in how you walk and how you move. 3 months produces a body that responds to the world very differently than it did before. 4 exercises, 15 minutes every day. Single leg balance, retraining the proprioceptive system and the stabilizer muscles that catch you before a stumble. Heel to toe walk, recalibrating the dynamic balance coordination that keeps you stable while moving. Half squat, rebuilding the lower body strength that supports every movement you make. Seated leg raise, restoring the hip flexor strength that allows you to take full, confident strides instead of a shuffling, dragging step.